Hello again at EASD TV. Well, I'm delighted to welcome someone very special and who's going to tell us about his experiences, and that's Boris Mankovsky, who is a diabetologist from Kyiv in Ukraine. We've been talking a bit about some of the difficulties of carrying on looking after people with diabetes in situations of natural disaster or war, and oh my goodness me, you've had such a time of it in Kyiv. So tell me, how first have you coped with supplying medicines, treatments, monitoring for people with diabetes?
Well, first of all, I would like to thank for invitation and for it is a great opportunity for me to be here. And I would like to tell that really when the war started, when the war erupted, well, everybody knows that it happened February 24th last year. Actually, nobody was prepared because nobody in our country believed that it would happen. Of course, there are a lot of signs, very ominous signs that it would happen, but people didn't believe, and that's why I would say that we were not prepared. And talking about diabetes care, we faced really very tough time because we faced the significant shortage or even lack of insulin and oral hypoglycemic medications. We faced shortage of strips to control blood glucose. We faced shortage of other medications. For instance, in the endocrinology field, we didn't have enough supply of levothyroxine. So that's why our main task for the time was to provide some sort of insulin. So that's why our very first decision with Ministry of Health was to provide a document for our doctors how to change insulin, because if insulin which was used for patient was not available, so it was possible to change it, to switch it to another one, similar one, and so on. So and that's why and I think such situation was for 2-3 months, and I'm very grateful for everybody around the world who helped at this time, because we got a lot of humanitarian aid from many countries, probably so many countries, from so many people. Also, I am very grateful to our partner from pharmaceuticals company, which also helped not just to provide insulin for free, but they also distribute it in the affected area. Also, we faced the huge move of patients and people generally, and of course patients from Eastern Ukraine, from Central Ukraine, abroad to Europe and to Western Ukraine. It created very unequal distribution of people, very unequal distribution of patients, very unequal distribution of physicians and nurses. And so it was shortage of nurses and physicians in one areas and a lot of patients in another areas. Also, pharmacies stopped to operate. Approximately 50% of pharmacies stopped operations because, first of all, they didn't have supplies, and secondly, they didn't have person to work in the pharmacies. So it was really terrible time. Now, of course, still the war, it's still very difficult, but at least now we have, let's say, a sufficient supply of insulin, we have sufficient supply of other medication, so it's not a problem. At least it's not a problem in Central Ukraine and Western Ukraine. But of course, it's still a problem in the affected area in eastern and southern part of our country.
Now, when we had COVID, it was a terrible, terrible time, but actually we learnt a lot. And some of the things that we learnt during COVID about treatment of diabetes, for instance, the greater pickup of digital solutions. Have you been able to develop any new ways of managing treatments? Because you've thought you've had to do it in a particular way, but actually it's turned out to work quite well.
Absolutely. And actually our experience from COVID times also helped us this time as well, because we were used to distant medicine, to distant medical care. So we also applied this experience, this knowledge to the war situation. But also we got, of course, additional new experience. Unfortunately, of course, I would prefer not to have such experience, but we got such experience. So now we delegated much more responsibilities to other physicians, to general practitioners, because before the war they mainly didn't care for patients with type 1 diabetes. They didn't prescribe insulin themselves because it was obligation and job for specialists, for endocrinologists, diabetologists. Now we delegate delegated such obligation to general practitioners. We delegated this to nurses. So we tried to modify the existing system of medical diabetes care to new realities, to new situation, and I would say that it definitely helped.
And are you seeing a rise in the, because I was interested, there was a lot about stress, and I wondered whether you're seeing a rise in either type 1 or type 2 diabetes.
I'm sure that it will be higher incidence, but so far we don't have statistics, because we don't have possibility to analyze, to compare, because it's still war and it's still huge movement of people. Because still it's official estimations that around 8 million people, Ukrainian people, are now out of the country, and Ukrainian population before the war was 42 million. So every 1 out of 5 people is out of the country.
So enormous counting difficulties.
Yeah, so that's why it's very difficult, even impossible, to get real information about incidence. But what I'm sure about that, of course, the course of diabetes is much worse, because how can we ask patients to follow regimen? How can we ask patients to follow physical exercise, diet, and so on, if patient has to spend few hours every day or every night in the shelter? So that's why there is no way to ask for regular requirements, for regular advice, and so on. So that's why I'm sure that the control will deteriorate significantly, and unfortunately we'll get a lot of complications, let's say specific diabetic complication, and probably not specific like depression, like distress, because everybody is under pressure. Because even in Kiev is not affected, by front line, is not in front line now, but almost every night we have air attack, we have sirens. So how can we say about regular or calm life?
And during last winter, you had some times when the power was off and people were very cold, and it was very difficult to.
Absolutely, and even in our hospital, our center is located with a huge and very modern, actually, cardiology center. And even in that hospital, our surgeon started the surgery, cardiac surgery, bypass, and it was shortage of electricity. It was blackout. Of course, we have generator, but it took 2 minutes to 3 minutes to start. But they opened already surgery, so they had to continue it with their cell phones just to get some light. And it was covered around the ward and so on. It happened exactly in our clinic. Thanks God, everything was okay and patients survived and so on. But really, it was terrible, because on average day people stayed without electricity for 6, 7, 8 hours every day for entire fall and entire winter.
Thank you so much for coming and talking to us about it. It's what you've gone through is just terrible. You're fighting for the whole of Europe. You're not just fighting for Ukraine. You're fighting for everyone. And for myself, for me personally, I thank the Ukrainians.
Thank you very much. Yeah, of course it's difficult, it's terrible, but on the other hand, I felt so many times, I felt proud of my fellow Ukrainians, because even you were talking about blackouts, and I remember our meeting, our conversation, our more or less professional activity during the time, and everybody was so calm. Well, okay, today there was no light for 6 hours or 8 hours or something like that. Well, so what? So we have to do this and this. So it's why it's really sort of patience, sort of resilience, which I am very proud of. Of course, it's not comparable with our military situation. Our military men, of course, they suffer the most. It's uncomparable. But even civilian people, even quite far from the front line, still they're very resilient and they're brave.
Well, thank you. Thank you very much, and there'll be more on EASD TV in a little while.